What if there was a simple, painless, and affordable way to prevent cavities from growing without drilling? Yes, that's exactly what silver diamine fluoride or SDF do. I am Bahare. I was a dentist in Iran and now I am working as a dental nurse in the UK. In this channel, I want to talk about anything that I find interesting and helpful to everyone in dentistry world. In this video, I am going to share with you what you need to know about SDF and how to use it in your dental practice. So, first thing first, what is SDF? What is silver diamine fluoride? If you look at the name, you can see what it consists of. It is the first one is silver. All of us know that silver is known for its antibacterial effect, actually a really strong antibacterial effect. So, as we all know, cavities and caries are created by bacteria. So, if we use something like silver on them, it will stop them immediately. The next one is our famous friend fluoride. You all know that fluoride can remineralize and strengthen the enamel, and it can help prevent caries if there is a white spot, and in the early stages of caries it can help the mineralizing process to stop and even reverse it by adding fluorohydroepoxy to the enamel, and it will actually strengthen the enamel. And so in this solution, fluoride will do its jobs in the best way. Actually, SDF has been used for decades in Japan, but in US and UK it get more popular in recent years. So, how we can apply SDF on the tooth? The first step actually is to protect the patient and to tell them about the process and to tell them about what SDF exactly do. You need to tell them about this treatment. And first thing that they need to know that it is not a permanent treatment, it is not a permanent solution for the caries, Sometimes we use it for uncooperative child, and we need to tell parents that we use it now to stop cavity, to stop the caries from getting more big and getting get the pulp infected, or any other side effect that any caries will have. And so they need to know that this is not a permanent treatment for the caries. It is something that can buy us some time for the child to get bigger and could cooperate with us during the treatment. After that, we need to protect. Actually we have to put bibs on patients' clothes. It will stain clothes, lips or gums if they're not protected. So we have to put petroleum jelly or the Vaseline to lips and gums, or maybe other tools that we concern that it might get stained with the SDF. We can put petroleum jelly and protect them. Next step is to isolate the tooth. The best way to isolate tooth for any kind of treatment is rubber dam. But if we can't put rubber dam, it's not the end of the world. We still can use SDF, and it will be really efficient, a really good way to do it with cotton roll, because most of the time we will use it for children who can't bear lots of instruments or everything that we do and we use in our dental practice. So they will not accept using rubber dam. Cotton roll is enough. And actually we need to clean the tooth as much as we can. If we did a scale and polish, That's really good thing to do. But if we couldn't, we can just use some cotton palette, cotton roll, or anything that we can clean the tooth from food debris or anything that might got into the cavity. We need to clean it as much as we can. Actually, about caries excavation, it is not a necessary step. If we don't do any excavation, SDF will be able to do its job. But if we could just excavate using, a hand excavator, we don't need to do the drilling with hand speed, slow speed, or high speed. We can just use our instrument, anything that we can use as quickly as possible, because there might be a child or an elderly patient who can't wait too much for us to do lots of things. So we can do as much as excavation that we can do, soft part of the dentin that we can see in the cavity. That's enough. That's totally enough. So after all this step, this is time for applying the SDF. We will use a microbrush to put and scrub the SDF on the cavity in the caries area. So we just scrub it and then we leave it for about 1 to 3 minutes. After applying this, we can see that the caries and all the demineralized dentin or enamel will get dark brown or a black color, and that shows us that SDF has done its job. After that, we need to remove excess. There might be some solution that stayed in the cavity. So we just use a cotton palette or cotton roll to remove the excess, and that's done. If we don't have time, if the child is crying and just want to go home, we can stop in this step. But if we could do, we can add potassium iodide or Ki as a solution that will help us to have a more natural color in that carious area. Actually, it just 1 or 2 minutes we apply Ki on the SDF, and then note that we don't need to wash SDF before applying Ki. We just apply Ki directly on the SDF, and if we wait, we can see that the area get better color, like creamy color, more like a natural color. But it's not a necessary step. It won't help SDF to do better, to stay longer, or anything else. It is just for the color. After that, we need to tell patient to show parents about the color, but we need to tell them that we have to see them in 6 months. Why? Because we need to reapply SDF every 6 months if we didn't do any permanent treatment like fillings, SS crown, or anything else. So here is some scenarios that we can use SDF. So as you can see in this picture that I'm showing, there is a cavity and caries in this deciduous molar, and even if the child is a cooperative child and let us do our job, one of the things that we can do is smart treatment. So here is a few scenarios that we could use SDF for them. It will help you to decide better how to use SDF or for who you can use SDF. Actually, there is a very famous option for deciduous teeth. It is called SMART, and it stands for Silver Modified Automatic Restorative Treatment. How we do SMART. First, we see caries and deciduous tooth, deciduous molar, and we can see that there is no sign of infection, pulp infection. We couldn't see any pedial widening, any radiolucency around the furcation or around the tip of the root, or any pain, any night pain, or anything else. There is just a cavity and a caries that it's only in enamel and dentin, and we can see that it exposed the pulp. So here is where we can use a smart. Actually, we don't need to do any excavation because it is automatic. It's supposed to be automatic. What we do, we apply SDF and we do all the steps that we talk about. After applying SDF to the cavity, we put just glass ionomer in the cavity. We don't need to do anything else, just put glass ionomer because we just want to, to seal that area a little bit so that there's no more food debris getting stuck in there or something, like to protect the area that we just got arrested using SDF, so we can protect it a little bit more. The other scenario, that imagine there's an elderly patient, I don't know, 90 or 80 years old, who has lots of complication and maybe they have some kind of mobility issues. They can't open their mouths for some really long times. And imagine that this patient has a really long bridge, and maybe most of the time this is the only teeth that they have that they can use to chew food. And we can see that there is some kind of, I don't know, maybe it is root caries, maybe it is caries under the crown. And these kind of treatments, they take a lot of time. There need to be several appointments for them, so that's not a practical option for these patients. Here is what we can do with SDF for them. We can apply SDF on the root caries, or maybe if there is a root sensitivity, maybe there's in the back tooth and this aesthetic is not important, and it will, most of them, they have gum recession, so we can just apply SDF because actually SDF is supposed to be a treatment option for sensitive teeth. We can apply SDF if there's a caries, if there is not a caries, and only there is a gum recession that will give our patient a sensitive tooth. But we need to tell them about the treatment plan. It's not permanent. You need to come again in 6 months, or anytime that you had, I don't know, you have your symptoms again, we can apply it again. And sometimes you can see, like a caries and distal upper second molar. That's really hard to treat, and people need to open their mouths for a long time, open really wide, and that's not something that most of elderly patients could do. So we could just apply SDF to stop caries. This is the only thing that we could do for them. Apply SDF every 6 months for them, just to stop caries. Tell them how to clean that area, some kind of devices that will help them to clean that area more efficiently. Actually, another scenario is that this is some kind of a permanent treatment, for deciduous teeth, which I used to do this because this is really time efficient, and the longevity of this treatment is really long. What is it like? We can use SS crown, and as most of you might know, SS crown is the best treatment option for deciduous molars because they are strong, they are really good, cleaning of them is really easy, and they won't break. As you know that if we use amalgam or composite filling our deciduous molars for about for like a 4-year-old or a 5-year-old patient, we know that they won't last until they get 11 or 12 until that tooth came out. So here is what we can do. If we see a deciduous molar with just the caries in the dentin, and we don't have a pulp exposure, any other symptoms, radiographic signs that shows us that the pulp is infected, so what we do, we just do our SS crown preparation. Sometimes we don't even need to apply anesthesia. We just do the preparation for SS crown, and actually we act like there's no caries on the tooth at all. We just do our preparation, and on what is left on the tooth, what is left of the cavity on the tooth, we just apply SDF on that. We don't excavate it more just to get rid of all the caries. We just apply SDF and then cement our SS crown. This is it. This is a very good treatment option for children. Actually, like every other treatment options, SDF has lots of limitations and drawbacks. As you know, the SDF will darken the tooth, so we can't use them for aesthetic area for people or even for children who are, most of them, they know about the dark color on their tooth. They don't like it. People may get attention to it, and they will not like it. They will not have a good feeling about it. So sometimes we can't do it, and we should accept what our patient wants. And as you know, this is not a permanent solution. This is not for 5 or 6 years. We just leave the tooth with the SDF and supposed to stay there and stay for the caries to stay arrested for 5 or 6 years. If we had a really deep caries with pulp exposure and they have some kind of pain, we won't take any advantage of doing SDF on that kind of tooth. As this treatment option is really affordable, it doesn't need a very long appointments. It is getting more popular around the globe, mostly in public health. If you work for public health section, you have lots of patients that don't have a good socio-economic level. They can take advantage of SDF very much. Because if, for example, if we had a child, for example, 4 or 5 years old with all the deciduous teeth has caries, and if we don't do anything, any treatment, most of them won't get any treatment, we can just apply SDF every 6 months. This is affordable, this is simple. We can just apply it and wait for their permanent tooth to come out. Sometimes it's the only option that we have, so it is something more for public health area, and for aesthetic area. If they don't do anything for the incisor, for the incisors tooth, they will get worse, they will get infection. We all saw those permanent incisors came out in the wrong place because there was a huge periapical lesion and it just displaced the incisor, the permanent incisor, and they will have a very big problem in the future. They need to do orthodontic treatment and lots of other things. So it's not that bad to have a black incisor tooth when you're about 4 or 5, and so with that you can prevent bigger issues than when you get a teenager. So this is it. If you found this video helpful, like and don't forget to subscribe. Ask me any questions that you had. I will answer to all of them. I hope it will help you become a good friend with SDF, because we all can use it. And see you in the next video.